Hello, everyone. It's March the 1st, Monday. You know, this month really is probably the month, almost a year ago now, that we started really beginning to feel the gravity of this entire situation. A pandemic like none of us have ever been involved in. A pandemic with no playbook, with no nothing. And we had to make our way. And West Virginians, I congratulate you 1,000 million times over. I mean, when you just step back and just think, the third oldest state in this country, a state really and truly that is plagued by chronic illnesses everywhere and surrounded by border counties on all of its borders. It's amazing how primed we were to have total disaster happen to this poor little state. And just the other thing happened. You became the envy of not only the nation, but the envy of the world. You held together. And absolutely, I am honored beyond belief to have been your governor through that time period and continue to fight this terrible, dreaded killer. I can tell you this, and I am so delighted by this, it's unbelievable. But we have lost nobody in the last 24 hours in the state of West Virginia. That is something that has been a long time coming. Now, on Saturday and Sunday, we had deaths reported of 9 people. But in the last 24 hours, 0. And that's really, really, really good. Now, we hate like crazy to think about these 9 people. And absolutely the families that are hurting and all their loved ones as well. Please, please don't ever let them become just a statistic. Please just don't let them become a number. These great West Virginians have given so much, and now I'm going to read each and every one. Our 2,292nd death is an 83-year-old female from Raleigh County. Our 2,293rd death is a 76-year-old female from Wood County. Our 2,294th death, a 55-year-old female from Raleigh County. Our 2,295th death, a 71-year-old male from Kanawha County. Our 2,296th death, a 79-year-old male from Lewis County. Our 2,297th death, a 47-year-old male from Kanawha County. Our 2,298th death, a 76-year-old male from Preston County. Our 2,299th death, an 83-year-old female from Clay County. And our 2,300th death in the state of West Virginia, get this, a 31-year-old female from Kanawha County. Tough stuff. Tough stuff. West Virginia, you're doing better. But still, please let these people know they're not alone. Our numbers in the last 24 hours in West Virginia, we had 193 positive cases. That's great. Our daily positivity rate, 4.39. Our cumulative rate continues to fall. It's at 5.46 now. Our active cases are under 7,000, 6,997 active cases. That's the 44th straight day that's dropped. And we have 122,751 that have recovered. And you see those lines, that are out there right in front of you. Your active cases are the dark blue that are going down, recovered cases light blue going up. That's what we want to have happen in the state of West Virginia. And we have 23, nearly half the counties in the state are back green. And that's wonderful. As a reminder, I tell you over and over, if you're 65 years of age and you get that sniffle or headache or tiredness or whatever it may be, go get a test. Go get a test as fast as you possibly can. And absolutely, at the end of that and everything, if by chance you were to test positive, we'll be able to give you these life-saving antibodies and everything and absolutely turn this thing around. Just as our President Trump took, a good while back, and you saw how fast he bounced back and everything. Please don't let this thing progress and get worse and worse. Go get a test. Please go get a test. Now, I'm going to deviate just a little bit and everything. I'm going to report to you that, my job is always to look out for the safety and the health of all of our people, first and foremost. But my job is also to mind the store and take care of the economics. And so with that, I'd like to report, and I'll just do it very, very briefly. When we get into questions, I've got our Secretary of Revenue here, Dave Hardy, and he'll be able to help me out with, questions about more detail. But very, very, very proudly, I'm able to report again in the month, for, the way we've been doing and going right along and everything. But the month of February, we brought in another $34.2 million in surplus to our budget. We are up now to a year-to-date surplus of $208 million and change. And so all that is moving in just a terrific way. We are really proud of how we've handled the economics of this state, and we continue to do just that. These numbers are terrific numbers, and we're just going to keep at it. So we'll get into any more detail about that in just a little while. All of our businesses, our guidelines, all of our businesses must still continue to follow our guidelines and all the other safety guidelines. All businesses must continue to follow all these safety guidelines that I've announced, even though there's several restrictions that we have lessened. The guidelines are still in effect. Such as, your mandatory face coverings in public buildings and so on, and all the different stuff from social distancing to everything that's up on our website. Now, it is my sincere hopes that as we go forward, maybe even as early as the latter part of this week, we'll be looking at maybe even the possibility of lessening some of the guidelines that we still have that are still in place. We want to continue to be able to live with this virus. We continue to get vaccinated. As that goes up more and more and more, we'll just back off and lessen even more. We're at 95.4% on the administrative rate of the first and second doses right now. Goal is always get to 100%, but we're just doing it, and we just continue to do that. We have got shots in arms of 496,698 West Virginians. That's absolutely terrific. It is saving lives. We're seeing it happen, and there's no way to go by this without thanking all of our community leaders, all the local health clinics, the DHHR, the National Guard, everybody that's involved, all of our first responders. You have been unbelievable. And just keep up the great work. We continue to lead the nation over and over. We've just done it, and that's really just fabulous. We have now got 11.7% of our total population fully vaccinated with both shots. And West Virginia, if they were a country, and this is hard to imagine, we would be ranked 7th in the world in West Virginia as far as taking care of our people and getting them vaccinated. Johnson & Johnson vaccine, we hear more and more good stuff about this, and on Saturday the FDA authorized the Johnson & Johnson vaccine for emergency use. We anticipate receiving approximately 15,500 doses for our first shipment this week, and we are also receiving 34,100 doses of Moderna and 36,270 doses of Pfizer this week. That total for the total vaccines coming to West Virginia this week, we anticipate, are 92,770 vaccines. Again, I thank all those that have pushed on our federal government to get us the vaccines. We're ready for them. We're going to just knock them out just as fast as they get here and everything. Now, I warn everybody and I caution everybody that number 92,720 is both doses, first and second doses. All of our pre-registering stuff is up on the screen and everything. We have pre-registered now 310,000 West Virginians. We want to strongly encourage, those in Mercer, Mingo, Wayne, Mason, Jackson, Monongahela, Mineral, Morgan, Berkeley, and Jefferson counties are still a little behind, and we want to continue to push you to get people 65 and older, absolutely registered. It'll just make us be able to get their vaccines to them and get them to them faster and more efficiently. All of our vaccine clinics are up and going in all of our 55 counties. Names are being pulled from the West Virginia COVID vaccine registration system to fill out appointments after wait lists are exhausted, to all the clinics that are listed as full-time, at this time. I want to continue to encourage all those 65 and older to get registered. Please do that. Of course, naturally, we don't have enough vaccines to do everybody just on day one. So far, this number is the number that we should really dial into more than anything. We've got shots in arms of people age 65 and older, and we only have about 350,000 total in the state. We've got half of them. We've got half of our total population that's 65 and older with shots in arms right now. And absolutely, we want to encourage, without any question, people that are hesitant about getting the vaccine, come on. Come on. You watch the TVs and everything. Quit believing this crazy stuff about the deer antlers or something like that. Absolutely, just come on and get your vaccine. We need you to do that and everything. We'll save your life. That's just all there is to it. The COVID info line is up there and everything. You've got all that. Reminders again, there was a thing on one of the national broadcasts this morning about, one of the doctors answering the questions, can you get COVID from this? And it is impossible to get COVID from taking the vaccine. So keep taking the vaccines, keep working this. We want to continue to offer the free testing. The free testing map's up on our screen, from the standpoint of special thanks to Walgreens and Frith for all that they've done. It's been phenomenal. Take advantage of our free testing and everything. Could very well save your life in every way. We have only 9 outbreaks in our long-term care facilities now and only 1 in our church community, and that's in Webster County. I encourage all those to continue to keep that pew in between you, keep doing the great work. Wear your mask, West Virginia, absolutely. We're almost there. Hang with me just a little longer. We're going to get there. At corrections, there are 17 staff now and 83 inmates. The inmate cases include 66 at Southern Regional. It's pretty common, is it not? Once we get this in a spot and everything, the numbers jump and they jump real, drastically and everything. We have 12 cases in our Western Regional Jail. All this is going to be just people running to the fire and absolutely doing everything that we can to protect our people and take care of those that need us to take care of them. Wear your mask, give blood, especially if you've recovered from this dreaded killer. I feel like you have a real obligation to step up in a big way and go and give blood. From the standpoint of our ACT funding and Promise Scholarship, I've got good news to report on both fronts and everything. First, working with Chancellor Tucker, I am authorizing $347,000 in federal gear funding to cover the cost of ACT on-campus exams for seniors applying for the Promise Scholarship. According to the ACT, West Virginia is the first state in the nation to cover these testing costs for our seniors. I am really proud to do that. Our kids have heard enough. For crying out loud in their families, if we can step up and help out just a little bit, we want to do that. And again, West Virginia, first in the nation, in covering these costs for our seniors, that couldn't be better. And everyone, I want you to listen to this. Secondly, I have asked Chancellor Tucker to ask her board to push back the promised scholarship application deadline. And she has committed to me today that will happen. So we're pushing back the deadline, for people to apply for the promised scholarship. And we're also making funds available to kids to be able to take this ACT test at no cost to them. From a state of preparedness, we on Saturday evening, I declared a state of preparedness in 48 counties across our state due to the flood warnings that were out. While the rain is ending this morning, praise the Lord and everything, numerous rivers and creeks are still up there and raging. And everyone knows, you've got to know, in our state with our mountains is so severe that there can be significant flooding happen very, very quickly. You've got to be on guard about that and know that there could be loss of life and loss of just everything. You have got to really be careful. Really, really watch. The Pocahontas County Office of Emergency Management and the town of Marlinton have issued a voluntary evacuation order for residents in low-lying areas in Marlinton. I was through Marlinton on all the days are running together. Saturday evening. So what an incredibly wonderful community and everything. The New River and Knapp's Creek, which is right outside of Marlinton and everything. I went right by both places and everything, and there's areas that are impassable. Shelter's been established in the Marlinton at Marlinton Middle School for those that have need. And all I do is just remind everybody, don't drive through standing water. I mean, it's very, very dangerous. If the pavement would be washed out underneath that water, you can't see it. You drop off, you're in a heck of a mess and everything, and it could be a life-saving thing to not drive through standing water. So just be really, really careful and everything, because I've been through the terrible flood of 2016 and on and on and on, different things that have happened in West Virginia, but we're going to have to deal with this. We should be expected to be prepared about every year, this time of year. This is something that you're going to have to deal with, especially in the Marlinton area and those areas that had a pretty good bit of snow on the ground and everything. You have rains and everything. Well, what do you think is going to happen? I mean, the snow is going to melt, compounded by the rain, and all of a sudden you've got it coming off these mountains and everything, and they're pretty severe, so please be really careful. Today is History Day, and I have signed a proclamation declaring today is West Virginia History Day. Over the past 25 years, hundreds of dedicated West Virginians have been recognized by the historical community as history heroes. And today, we all know West Virginia was born in the midst of the Civil War, and it's been an incredible state, and all through the years. And today, we have an unbelievable gentleman. He's our curator of the arts, Randall Reed Smith, and he's holding a virtual event today to recognize 17 of the 2021 history heroes. And I want to join Randall in congratulating and celebrating this tremendous accomplishment by these 17 individuals, and also celebrating our shared heritage and how much that we promote all of our culture and all of the very fiber that has made us what we are in West Virginia. So it's a great state with great people, and we should be proud of our tradition, our heritage, and everything, and I surely am that, and I want everybody in West Virginia to be just exactly that. We have a new DOT map, a projects map that's up now. It's coming out today, and I'm happy to announce the West Virginia Department of Transportation's online project map, which shows every bridge, road, and maintenance project in the state and is now live and everything. You should be able to go online. Our entire team at the Department of Transportation, from the crews to fixing our roads every day to the staff responsible for putting together this map and many others, we continue to raise the bar in West Virginia year after year. We still have a lot of work to do, a lot of roads to fix, and we're going to stay right after it and everything. Like I said over and over, this didn't get this way on my watch, but on my watch we're trying to fix it and we're trying to turn it around. You know, as far as my town halls on the personal income tax, I'll be having another one tomorrow. We're going to schedule it for noon tomorrow and everything. And so tune into that and we'll answer your questions. Send your questions in. We'll answer as many as we possibly can. We'll probably go about an hour and 15 minutes and in just our effort to try in every way we possibly can to better educate the public and everything about the implications and the impact of what could be the absolute opportunity that is where there's none ever been, that it even approaches what an opportunity that this will be in the state of West Virginia for us to really bring job growth and increases in wages and all the different things, from increases in our property values to all the different things that can happen to us in the state of West Virginia, and do it. And my level of accomplishment needs to be just one thing. We want to try to do this with a net savings to where we put extra dollars in every single West Virginian's pocket, and while at the same time driving all kinds of potential growth to West Virginia. So 12 o'clock tomorrow, if you got a few minutes and everything, please watch it and send your questions in and we'll answer them in every way. I've got one last thing. We announced this the other day, but I want to surely bring this back up again, because I believe we owe everything we have in this country, everything, to the active military and to those that have served already in years past. But yesterday we deployed 125 soldiers from the West Virginia National Guard, 111th Engineer Brigade were deployed for the Middle East. And their mission will be to conduct engineer tasks such as project development and construction missions, while also supporting our partner nations. Kathy and I send our best wishes and everything for Godspeed for these great individuals and everything to do their mission and protect us and look after this great country, and then get home soon and get home safely. You know, I've said it over and over and over, but these great people, what they give is unbelievable. What they ask is almost nothing. Keep them in your prayers. Absolutely. Keep them in your prayers. These people are making us and giving us all that we have in every way. That's all I got today. Anyway, thank y'all.
All right, thank you, Governor. Let's now go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. As the Governor pointed out, we continue to make solid progress in our vaccination efforts. We continue to focus on our plans, and we'll continue to attempt to engage a variety of groups to help us get more of the population over 65. We know that the strategy is working, and we're going to stay disciplined on that. In the first 7 weeks of this year, we've seen an 85% reduction in our death rates. Our hospitalization numbers today, 225 total, is one of our lowest in a long time. So we've got to continue to stay focused on those efforts. We'll continue to shape our delivery methods going forward so that we can again penetrate the larger areas of those demographics of the populations that we need to get at, and continue to work with organizations to help us reach those groups. Last thing I would leave you with is that there's a lot of work that goes on behind the scenes to make these things happen. A lot of coordination. For example, today, coordination calls with all of our counties to prepare for the arrival, we believe Wednesday, of Johnson & Johnson vaccines and the others, and the numbers that the governor laid out, which are unprecedented for us. But also over the last 7 weeks, on a weekly basis, in some cases, we've replaced in the ancillary kits as many as 30,000 syringes to make sure we've got the right capability in place for all of those who are actually administering the vaccine to get the maximum number of doses out. So just want to make sure that folks understand there's a lot of work that goes on behind the scenes. Folks are doing a great job, and the governor's keeping us focused and disciplined on our approach. Thank you.
Thank you, sir. Next to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. It's great to be with everybody again today. Let me reinforce a few messages the governor has made and that General Hoyer made here recently. So it is really, really good news for our country that the third vaccine, the Johnson & Johnson vaccine, has now been approved for emergency use by the Food and Drug Administration, and also secondarily certified by the CDC, the Centers for Disease Control. It's really important for all West Virginians to recognize that all three of these vaccines now, the Pfizer vaccine, the Moderna vaccine, and now the Johnson & Johnson vaccine, are all incredibly safe and all incredibly effective. And they're all really equally effective at what we really are focused on, which is to save lives, to keep people out of the hospitals, to prevent people from getting sick enough if you are infected with COVID-19 to need to go into the hospital, and to block severe disease, severe complications of any type of infection. And the Johnson & Johnson vaccine is 100% indeed. And our plan is that we want to just put Johnson & Johnson into the same rotation that we're using for the Pfizer and Moderna vaccines. The benefit is you need only one dose of the Johnson & Johnson vaccine, and it is easier to store. So for some special populations as we go forward, that may be an attractive sort of use, and people who are homebound or people that it's very difficult for them to receive more than one dose of a vaccine because of anxiety and other things. But Johnson & Johnson vaccine, very effective. I want to touch on one more thing. So I've had the opportunity to be on a number of national calls and to interact with a number of people that are leading efforts in various states. And the one thing that's really clear to me, and you know, we've really been very proud of the efficiency and the number of people that we've reached with the vaccine distribution effort. Certainly kudos to General Hoyer and retired Colonel Peel and the JIADF and certainly the DHHR and all the good people working there. But I think that the one thing that's really becoming very much apparent to me is one of the reasons why we've been so successful in our real outcomes that we're interested in, which is how many lives are we saving, what's happening to the death rate, as General Hoyer suggested. Over the first 7 weeks of 2021, we've seen a week-to-week 85% reduction in deaths and a really amazing reduction in hospitalizations. It's because we've been very disciplined as well about really targeting that group of West Virginians that is the most vulnerable. We've talked about our long-term care population, the residents of long-term care facilities, assisted living, our West Virginians over 65 years old. Remember, if we look at 60 and over from our own epidemiology data, that accounts for 92% of the ages of West Virginians dying of COVID-19. If we look over 70 years old, 77.5% of West Virginians dying are over 70 years old who've died of COVID-19. And over 50-year-old West Virginians, that's 97% of all West Virginians dying. So the fact that we've not only been really good about getting shots in arms, which is so important, but we've really been very disciplined about getting shots in the right arms. And we really thank all of the citizens who've been patient to help make sure that we're immunizing our friends and neighbors and family members who are in those really vulnerable groups. And we continue, as we have more vaccine, to work with the governor to look at what our next phases will be. But I think this really, really goes to the discipline and the focus and the successful execution of this vaccine distribution that's really been under the governor's leadership and vision. But so many people have operated well, including every citizen of our state. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Secretary Bill Crouch with the DHHR.
Good morning, everyone. As the pandemic continues, we want to remind folks of the following helplines that we have available. Help 304 is West Virginia's emotional strength line. Crisis counselors are available for stress management and referrals. Help 4WV is for substance use disorder and behavioral health issues. The National Suicide Prevention Lifeline, help is always available on that line. And the Children's Crisis and Referral Line is available for families and youth to talk with crisis specialists to help de-escalate a crisis. All call lines are available 24 hours a day. This pandemic is difficult for everyone. Please check on your loved ones, your friends, and your neighbors. Help and support each other, and we will get through this. Thank you.
Thank you, Secretary. And next to Dr. Ayn Amjad, our State Health Officer.
Good morning. As the Secretary mentioned, the state has many resources if you're feeling any stress or anxiety. And we do want to remind everyone to call your loved ones or your friends or family. And if you're experiencing any signs of stress or emotional turmoil, such as inability to sleep or difficulty eating or any of those stressors, to call the emotional helplines that the Secretary did mention. It is normal to feel these stressors during a pandemic. There is social support networks out there, and to please call those numbers, especially during times of social distancing when you can't see your family and friends. It is important to take care of our emotional health as well as our physical health during this time. Thank you.
All right, thank you, Dr. Amjad. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, you said later this week we could see further lessening of restrictions. Are you saying like rolling the occupancy limits on restaurants back, further public gatherings, the same kind of restrictions that we just lessened? Would it be those ones, or are there other ones on the table? And as of yet, are there any measurable impacts that we've seen from this most recent round of lessening of restrictions? Thank you.
Charles, I think it's premature, but you know, in just having discussions with all my health team and all the different people from the standpoint of looking at where we are in the state as far as positioned, you know, from the standpoint of being back in school, from the standpoint of athletic competition right around the, you know, corner, from the standpoint of where we are with small businesses still that are suffering and everything and need us to try to help them in every way we possibly can. I'm just continuing to look, and anywhere I can, you know, back off just a little bit and everything. We want to be able to do it, but it's premature for me to tell you, you know, exactly what right at this time.
All right, thank you, Charles. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, it's Kenny Bass with Channel 8 Fox 11. Distribution questions for General Hoyer, if possible. I know that the state has expanded its vaccination prioritization list to include now essential workers. I think it's 50 and older. Correct me if I'm wrong. But can you talk about how that seems to be going out, and has the glitch that was discussed with Walgreens been taken care of? And also, very briefly, if you could talk about where we are on delivering vaccines to homebound patients, receiving concern from people who are homebound that they haven't heard a definitive plan yet. I know you've talked about incorporating local health departments into that mix. Have those talks proceeded, and is there a time when you can say that program will start? Thank you, sir.
General, please go.
Yes, sir, Governor. So, Kenny, I think first, yes, we have expanded into the 50 and above critical workforce group. We are using primarily the pharmacy piece to address that initially. We do still have some challenges in the rollout of our list and the linkage, and we appreciate the work of Walgreens with us as we work through those challenges. We have also, working with senior services, identified around 2,000 of a population of about 4,000 homebound individuals that they have provided us. So we are in the process of working that work. As Dr. Marsh pointed out, one of the things that we'll be looking at is the single dose a better logistical opportunity for us to get to certain populations that we know are vulnerable and we need to get vaccinated as quickly as possible. So we continue to work all those areas to make things work effectively and get to those populations.
All right, thank you, Kenny. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. I want to drill in a little bit on what Secretary Crouch and Health Officer Amjad was talking about with the opioid epidemic. I know that it's been a tough lift for the department because you were dealing with the opioid epidemic when the pandemic broke out. How has the pandemic affected treatment? Are you getting any indications from the field whether people are re-engaging with treatment? What kind of concerns do you have?
I think Secretary Crouch and Dr. Amjad, if y'all would talk, please.
Thank you, Governor. I'll start on and then you can jump in. Paul, that's a great question. We have been very concerned, and I will say DHHR has a great staff that have continued the efforts throughout this pandemic that are needed to try to provide support out there. But as we talked about a little earlier, the support needed for individuals who have SUD is crucial. And if that support is lacking, then it's difficult for individuals to really stay in treatment, stay in recovery, et cetera. So you've probably heard us talk about the teams that go out to the homes after an overdose. That dropped off significantly during about a year ago, a little less than a year ago. Those numbers have come back up, but we still have to follow guidelines there in terms of social distancing, in terms of masks. Individuals are not going into homes like they used to. So it is difficult. It's a difficult time for all. So we're very concerned about overdose deaths. We're trying to track all of that, but it's a great question. Thank you. And we want to keep those folks focused with regard to what we call the epidemic within the pandemic. Ann, you want to add anything to that?
Sure, Paul. The only thing I would add to that is that we have engaged with our behavioral health teams to see what we need to do moving forward. But along with the opioid problem, our concerns are with the group not meeting with their counselors due to the restrictions with COVID. So we have engaged with them because we do know that population also suffers from depression and anxiety. So we are addressing that head on, and we encourage people to continue to meet with their counselors, to continue to meet with their support groups, and to address those problems, and for also people's family and friends to be alert of that as well, and to see if there are any signs of concerns for regression into those behaviors, and to watch for signs of overdose and to be mindful of that. But those are good questions because those are definitely concerns that we've been aware of as well. Thanks, Paul.
All right, thank you, Paul. Next to Mark Curtis with Nexstar Media.
Good morning, Governor. Good morning, staff and cabinet members and fellow members of the press. I'm glad to report I got my first shot of Moderna yesterday, and near as I can tell, no antlers have sprouted on me, so I'm happy about that. Governor, I want to ask you specifically what else you're doing in terms of emergency response to the flooding we're starting to get reports of from all over the state. And in an additional part of that question, I'd like General Hoyer to address, is the flooding going to cause any problems in terms of getting vaccines out and distributed like we had 2 weeks ago when we had the ice storms?
Well, Mark, from my standpoint, congratulations on getting that first shot and everything. That's really good. And, with the first shot, just in a matter of a few days here that you'll be well on your way to protection, at a pretty high level. And I'm really tickled that you haven't gotten your deer antlers yet. I don't know anybody that has, but I'm glad you're not getting them yet either. But from the standpoint of the flooding and everything, we continue to monitor all the situations and everywhere, and there's no unmet needs that we know of at this time at 11:30, as of 11:30 this morning. But we're watching everything everywhere, and as needs come up, we'll address it, and we'll be right dead on top of it and everything, as we've been over and over. We got an incredible team, and they do unbelievable work, and they know that one of our sure mottos is run to the fire. And so if we've got any real needs or whatever like that, we're gonna just do it. I mean, that's just all there is to it. It doesn't matter if you're tired or whatever the situation may be. We got to step up. We got to address what we got to address, and we'll do it. That's all there is to it. So with all that, General, if you could jump in on the second half of the question, please.
Yes, sir, Governor. Mark, as of right now, we don't know specifically that we will have an adjustment, but I think it's important for folks to understand the value of what the governor established in the interagency task force was we have all these agencies from local, state, and federal coordinating across the spectrum with each other. So we will anticipate potential challenges, and where we need to make adjustments, we will. And just like with last week's weather, we may have some impact, but our job is to minimize those and make sure we're getting shots in arms.
All right, thank you, Mark. Next, we'll go to Veronica Obey with WDTV.
Yes, good morning. Thank you all for letting me join. My question might be geared towards Dr. Marsh, but if you could just elaborate on what you meant in regards to the Johnson & Johnson being used for emergency use, as well as with it being only one dose, do we see this becoming more accessible to those in the community over time?
Okay, Dr. Marsh. How you doing, Veronica? Tickle you're here. That's good. Go ahead,
Well, thank you. Thank you, Veronica. So it's really important that every vaccine that is approved for human use in the United States or any other drug needs to go through an assessment by the Food and Drug Administration, which then assesses all of the information from all of the clinical trials that are done. And then there's a group that advises the Centers for Disease Control if the Food and Drug Administration says, yes, this vaccine or this medication is safe enough and looks like it's effective enough that we want to give it authorization. And to give it really fast authorization, they have a pathway called emergency use authorization, EUA, which is how all three vaccines have been approved by the Food and Drug Administration. The advisory committee to the Centers for Disease Control oftentimes will say, well, this vaccine should be used for this purpose or that purpose. But what the CDC's advisory group said, because of the impact of the benefit of the Johnson & Johnson vaccine, much similar to the impact of the Pfizer and Moderna vaccines, they just said it should be used for all of the indications that you're using the Pfizer and Moderna vaccine. The two differences between the Johnson & Johnson vaccine and the Pfizer and Moderna vaccines are, number one, the Johnson & Johnson vaccine only needs one shot. It does not require two shots to be effective, to have its maximal benefit as demonstrated in the clinical trials. So therefore, in people maybe that are homebound or people who may have a disability of some sort or a lot of anxiety over, a shot, then that may be a better choice for them. And although we don't want to make it, you can choose this one or this one or this one, we want to just roll all the vaccines into a continuous pathway that whatever vaccine is available when your time comes, all three vaccines are really, we would say equally as beneficial. But in certain circumstances, there may be an advantage of using a vaccine that only requires one dose versus the other two vaccines, the Pfizer and Moderna, that require two doses. The other benefit of the Johnson & Johnson vaccine is it doesn't require nearly as cold temperatures to store it at. It can be stored in a refrigerator, and so it's much more resilient if you want to take it into rural environments and have to travel with it for long ways.
All right, thank you, Veronica. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Governor, last week you said you were going to look into instances of legislators flaunting the mandatory mask wearing requirement here in the Capitol. The issues seemed to escalate on the House floor on Friday, with a number of members being called out for either not wearing masks or wearing mesh masks or masks that are just made up of straps. Have you had the opportunity to look into any of these issues?
Phil, I'm having my people check it out and everything. I'm not aware of the thing, what you just brought up about Friday, but I'll check on that as well. I just, everyone knows the rules. I mean, I'm not the police force. Everyone knows the rules. Surely to goodness, we can be respectful of everyone, but I would highly encourage everyone to wear the mask. People feel pretty strongly about the mask deal, and I really don't understand it because we've proven how it can save lives and protect us, and we don't want to get lax right now. So let's don't start the celebration quite yet. The celebration's coming though, and we want to be positive about all that. But I'll check it out. I'll check it out more.
All right, thanks, Phil. Governor, I'll turn it back to you.
Well, I don't have a whole lot. We'll continue to look at everything we can possibly do to help our small businesses and help us try to as quickly as is safe and as appropriate to get back to as much normalcy as we can. And I hope and pray that's sooner than later, but at the same time, everybody's got to understand that we've done pretty daggum good in getting where we've gotten here, and so we don't want to just blow that and end up with another whiplash and everything. But as far as the flooding issues, they're not too bad as of yet, but we're watching, and we all know in West Virginia how bad and how tough that can get. From the standpoint of I guess if I were being just brutally honest, I wish to goodness that before we ran out and tried to make up a story or whatever it may be, I wish that we would always really pay close attention to my words and what I'm saying and everything. I have said all along how I feel like that our personal income tax, getting rid of the personal income tax, would be a step forward like you can't imagine. I've said all along, that really and truly just how our government does and how we do month by month should be of significant news. And we've almost gotten to the point in time where it's like old hat. Well, another surplus. Well, no real point in even reporting that, just another surplus. Well, it's big stuff. It's really big stuff. If you listen to my words, I made reference to the fact that, that we passed a right to work law and we didn't see people come. And, does that mean that I'm not 100%, on board with passing a right to work law? Sure, I've been on board 100%, absolutely. Absolutely. Am I on board, for all the different things that we've done on corporate tax or getting rid of prevailing wage and those kind of things? I'm on board. But at the same time, the truth of the matter is all the different things, even the things that I have been the author of, Roads to Prosperity and things like that, they have all been spokes in the cog. They have absolutely been spokes in the wheel as we have gone forward. But we're not there yet. We're just not there yet. We need to go one more step. And that one more step is just right in front of us. It's something that the state of Mississippi is trying to adopt right now and doing it in a much more harsh way than what we're doing it, as benign as we can possibly do it in West Virginia. But all the foundation that we laid along the way, people really didn't come. But that doesn't mean that the foundation wasn't good. and the foundation wasn't needed, all I would say is just this. If you're going to report something that I say, if I really screw something up, report it. That's great. But let's don't exaggerate and lead people in a direction that's not true. I mean, let's absolutely know that just this. I'm an absolute believer that we've been on a pathway in West Virginia for a long time, but we haven't gotten there. We are the only state in the nation that continues to lose population. How are we going to get over that hurdle? We have got so much to tell people about. The lowest property taxes, a great business climate, on and on and on, but we're not over the hurdle, are we? As we move forward and everything, let's get over the hurdle. Some people have even reported, about, the governor wants all these emergency powers. Are you kidding me? Are you kidding me? All I would say is just honestly, know just this. Everything is 100% transparent. Have we done good or have we not done good? We have knocked it out of the park. Do you have to act? You have to act. And so we have someone come out and say, oh, the governor is taking it personal. Bull's not. The governor's not taking it personal. The governor's trying to lead you down the path that makes it work the very best for all of us. That's all there is to it. I've said it over and over. Just tell the truth. Report the truth. And absolutely, West Virginia, you're doing so good. So good. Can we do better? Sure. Would it be a time we could step back and just do a victory lap? It could have been the easy way out. I don't believe in that. I don't think the people of this state elected me in every single county in the state. Every county. In the primary, they elected me by 45% of the vote. Now, they told me that, Justice, you need to get going and stay going because we have given you our confidence. And that's what Justice is going to do. And so I'm not just going to sit back and take the victory laps. I'm going to keep on trying to do all the good that I possibly can. Thank y'all so much, and let's all keep running in the right direction and pulling this rope together, and we'll get there. Thank you again.